You have been feeling more tired than usual lately. Your periods have been getting heavier. The bloating that used to go away after a few days now seems permanent. You have blamed yourself. Maybe you are not managing stress well enough. Maybe you need to exercise more. Maybe this is just what happens when you get older. But here is what nobody told you. By the time you reach 50 years old, there is an 80% chance you are carrying something inside your body that your doctor has never properly explained to you. They are called uterine fibroids. And while they are not cancerous, they are reshaping your life in ways you may not even recognize yet. The hidden trap is this. The symptoms you have been dismissing as normal aging or stress are actually your body trying to tell you that something structural has changed. And the longer you wait to understand what fibroids are and how they behave differently in your body than in someone else's, the more limited your treatment options become. Most women find out they have fibroids by accident, a routine ultrasound, a scan for something else entirely. By that point, the fibroids may have been growing for years. And here is the part that should make you pause. Black women do not just get fibroids more often than other women. We get them earlier. We get them larger. We get them in greater numbers. And the medical system has been slow to explain why that happens, or what you can do about it before surgery becomes the only option anyone offers you. What you are going to learn in this video will change how you think about your body and how you talk to your doctor. We are going to cover why fibroids develop, what makes them grow faster in some women than others, the genetic and hormonal factors that increase your risk, the hidden signs that most women miss until the fibroids are already large, and the treatment options that exist beyond hysterectomy that too many doctors still do not mention. This is not about fear. This is about giving you the information you need to make decisions from a place of knowledge instead of panic. Because at Marcus Webb, Black Health Truth, we talk about what actually happens inside your body, not what the standard 5-minute appointment covers. Uterine fibroids are non-cancerous growths that develop in the muscular wall of the uterus. They can be as small as a seed or as large as a grapefruit. Some women have one, some have dozens. The medical term is leiomyomas, but everyone calls them fibroids. Think of them like knots forming in the smooth muscle tissue of the uterus. Your uterus is designed to expand and contract, but when fibroids form, they create areas of rigid tissue that do not move the way healthy muscle does. That rigidity is what causes many of the symptoms women experience. Now here is where your ancestry matters. Research from the National Institutes of Health has shown that Black women are 2 to 3 times more likely to develop fibroids than white women. But the disparity is not just about frequency. Black women develop fibroids at younger ages, often in our 20s and 30s instead of our 40s. Our fibroids tend to grow larger, and we are more likely to have multiple fibroids at the same time. The question is why? The answer involves genetics, hormones, and environmental factors that interact in ways researchers are only beginning to fully map. One of the strongest genetic links identified so far involves variants in a gene called MED12. Studies published in the American Journal of Human Genetics found that mutations in MED12 are present in about 70% of fibroids overall. But the frequency and type of these mutations appear to differ across populations. Black women are more likely to carry specific variants that are associated with earlier onset and more aggressive fibroid growth. Your DNA is not your destiny, but it does set the baseline risk that everything else builds on. Estrogen and progesterone are the 2 hormones that drive fibroid growth. Fibroids have receptors for both. When your body produces these hormones during your menstrual cycle, fibroids respond by growing. That is why fibroids tend to shrink after menopause when hormone levels drop. But here is the part most doctors do not explain clearly. Black women often have higher circulating levels of estrogen throughout our reproductive years. We also tend to have more estrogen receptor activity in fibroid tissue itself. That means the same hormonal environment that exists in every woman's body has a stronger growth effect on fibroids in Black women. It is not that your body is doing something wrong. It is that your biology amplifies a process that happens in everyone. Vitamin D deficiency is another factor that keeps showing up in the research. A study from the Journal of Clinical Endocrinology and Metabolism found that women with low vitamin D levels were significantly more likely to develop fibroids. And Black women, regardless of where we live in the world, tend to have lower vitamin D levels than other populations. The reason is melanin. The same pigment that protects your skin from sun damage also reduces your skin's ability to produce vitamin D from sunlight. If you live in a region with less sun exposure, or you spend most of your time indoors, your vitamin D production drops even further. Low vitamin D affects how your cells regulate growth and inflammation. That creates an environment where fibroids are more likely to form and grow. Let me say that again. Your body is not broken, but the combination of genetic variants, higher estrogen activity, and lower vitamin D creates conditions where fibroid growth is not just possible, but likely. Now I know what some of you are thinking. My doctor never mentioned any of this. She just said fibroids are common and we will watch them. And I hear you. That is the standard approach for fibroids that are not causing severe symptoms. But watching does not mean understanding, and it does not mean you have no role in what happens next. The truth is that many fibroids do not need surgery, but whether you need surgery often depends on how long you waited to address the factors that make them grow. The hidden signs of fibroids are the symptoms you have been living with for so long that you stopped thinking of them as symptoms. Heavy periods. You have been using extra absorbent products for years, and you think that is just how your body works. Fatigue that does not go away even when you sleep well. You blame stress or not eating right. But if your periods are heavy enough, you are losing iron every month. That iron loss leads to anemia, and anemia leads to exhaustion that no amount of rest will fix. Your body is trying to function without enough oxygen being delivered to your cells. That is not stress, that is biology. Bloating that makes your abdomen look larger than it used to. You think you gained weight. But if you press on your lower belly and it feels firm instead of soft, that is not fat. That is a fibroid pushing outward against your abdominal wall. Frequent urination. You get up 3 or 4 times a night. You avoid long car trips because you cannot go more than an hour without needing a bathroom. You think your bladder is weak. But if a fibroid is pressing against your bladder from above, it reduces the space your bladder has to expand. You feel the urge to urinate even when your bladder is only partially full. Lower back pain that you have blamed on sitting too much or sleeping wrong. Constipation that comes and goes for no clear reason. Pain during sex that you stopped talking about because you thought it was just part of getting older. These are not separate problems. They are all connected to the same structural issue, and the system failed to connect the dots for you. She sat in that exam room after the ultrasound and stared at the screen. The technician pointed to 3 dark spots on the image. Fibroids. One was the size of a lemon. She had been feeling off for 2 years. The bleeding, the exhaustion, the way her jeans stopped fitting even though she had not changed her diet. She thought she was doing something wrong. She thought her body was failing her because she was not taking good enough care of it. And now she was looking at proof that something had been growing inside her the whole time. The doctor came in and said the fibroids were not dangerous. They could keep watching them, or they could schedule surgery to remove the uterus entirely. Those were the 2 options presented: watch or cut. She left that appointment with more questions than she came in with. If they are not dangerous, why is surgery the first real option? If they have been growing for years, why did nobody catch them sooner? And why does every woman in her family have the same story? If you are hearing this and recognizing yourself in any part of it, I need you to do something. Leave a comment right now and tell me which symptom you have been living with the longest. Because this is not just your story, this is our story. And the more we talk about it openly, the harder it becomes for the system to keep treating fibroids like they are just something women have to live with. There are treatment options beyond surgery, but you need to know what they are before the fibroids get so large that surgery becomes the only viable path. Medications like GnRH agonists can shrink fibroids by temporarily lowering estrogen levels. They do not eliminate fibroids, but they can reduce size and give you time to plan next steps without the pressure of emergency surgery. Uterine artery embolization is a procedure where a radiologist blocks the blood supply to fibroids. Without blood flow, fibroids shrink. It preserves the uterus. It has a shorter recovery time than surgery. But many women are never told this option exists. Myomectomy is a surgical procedure that removes fibroids while leaving the uterus intact. If you want to preserve your fertility or simply do not want to lose your uterus, this is the option to ask about. The challenge is that myomectomy is more technically demanding than hysterectomy. Not all surgeons are trained to do it well. And research from the American Journal of Obstetrics and Gynecology has shown that Black women are less likely to be offered myomectomy, even when it is medically appropriate. You have to ask for it specifically. You have to be prepared to advocate for yourself in that room. Diet and lifestyle changes will not eliminate fibroids that are already there, but they can slow growth. Foods that reduce inflammation and support healthy estrogen metabolism matter here. Cruciferous vegetables like broccoli, kale, and cabbage contain compounds that help your liver process and eliminate excess estrogen. Fiber helps your body excrete estrogen through the digestive tract instead of recirculating it. Omega-3 fatty acids from fish or flaxseed reduce inflammatory signaling that can accelerate fibroid growth. Vitamin D supplementation is critical. If your levels are low, bringing them up to normal range can reduce your risk of new fibroids forming and may slow the growth of existing ones. Think about what that means for your body. Every meal is a chance to either feed fibroid growth or starve it. That does not mean you have to be perfect. It means you have agency. You are not powerless. Here is what we covered. Uterine fibroids are non-cancerous growths in the uterine wall that affect up to 80% of Black women by age 50. You are at higher risk because of genetic variants like MED12 mutations, higher estrogen activity in fibroid tissue, and lower baseline vitamin D levels that create conditions for faster and earlier fibroid development. The hidden signs include heavy periods that lead to anemia and fatigue, bloating from fibroids pressing outward, frequent urination from fibroids pressing on the bladder, and lower back pain or constipation from fibroids pressing on other structures. Treatment options include medications to shrink fibroids temporarily, uterine artery embolization to cut off blood supply, myomectomy to remove fibroids while keeping the uterus, and lifestyle changes that slow growth by reducing inflammation and supporting healthy hormone metabolism. The science is clear. Your body responds to information. It responds to nutrients. It responds to the choices you make today, even if fibroids have been growing for years. What changes is not the biology. What changes is the quality of the decisions that biology now gets to inform. And having that information is itself an act of advocacy. You are not at the mercy of your genes. You are not at the mercy of a system that did not explain this to you sooner. You have tools now. Use them. Here is your challenge. Pick one thing from this video and apply it for the next 7 days. If your periods have been heavy, track exactly how many pads or tampons you use in a day and write it down. If you feel bloated, press on your lower abdomen and notice whether it feels firm or soft. If you are exhausted, ask your doctor to check your iron and vitamin D levels at your next visit. Bring one question from this video to that appointment. Do not wait for them to bring it up. You bring it up. Ask if they have checked for fibroids. Ask if myomectomy is an option if surgery becomes necessary. Ask what your vitamin D level is and whether supplementation would help. And if this video gave you information you did not have before, hit that like button and subscribe to Marcus Webb, Black Health Truth. Because we are building a community where health information does not stop at the surface. We go deeper. We ask the questions that do not get asked in a 5-minute appointment. And we make sure you have the tools to walk into any doctor's office anywhere in the world and advocate for yourself with confidence.